Hello. Happy Thursday. I hope wherever you are that you and your loved ones are safe and well, that you're having a good week and a good day. It's a better week than it was last week. Pain is still pretty intense, but we're in a better headspace, so let's get to it. I, in my geniusness, decided, without realizing it, to book all of my follow-ups for this week. So yesterday I had the cardiology surgeon, which went very well. I had the pain management doctor today, and tomorrow I'm seeing the stroke specialist. So, you know, one more for the win. Cardiology visit was great. It was just great. I got it there. I had to do an EKG, and then I did an echocardiogram, which I forgot how long those take. They're about 45 minutes. And it was an experience. But here's the best thing. Before the surgery, the cardiologist said there was a chance that when it was done, that there could be some leakage from one side to the other, that they may not be able to stitch it up entirely or patch it up entirely. It's just the risk we take during the surgery. The day of the surgery, they said there was no crossover, no leaking. So 3 weeks out, they did this test yesterday, and when she started, the technician, she started from my abdomen looking up at my heart. And so I said, what are we looking at? What angle is this? And so she said, oh, I can't give you any information in terms of results, but I can tell you where I am as I'm doing it. I was like, okay, cool. I said, I'm sorry, it's my curiosity as a nurse. It's the nurse in me. And she went, oh, you're a nurse? And she said, okay, well, I can't really say anything, but see this line? And she showed it to me, and I said, yeah. And she said, okay, that's where the PFO was, and it's closed, and there's no crossover. But that's all I can say. So I was like, oh my gosh, yes, it's a miracle. Actually, it's not a miracle. It's good surgical work. So yes, thank you, my surgeon, because you kicked ass. But it's officially closed. It's healing. It's good. And he came in and was telling my husband and I, and I had already told him what the technician said. I was like, they said it was closed. But when he came in, he was so happy and positive, and he said it went great. You know, your results are great. How are you feeling? And so I told him about the dragging nerve pain in my leg, and he wasn't thrilled about it, but he said, okay, he said, definitely talk to my pain management doctor, because that's his area of expertise, not the cardiologist. And so I told him I was seeing him today, and it was just a very positive visit. And so I just felt really happy when I left, because it just feels like it was the right thing to do, and the right thing to do. I'll just leave it there. But the team that did everything for me from start to finish, from that first visit to after the surgery to yesterday, have been amazing. I don't see them again until the late summer, early fall for a follow-up. And I think they'll just monitor me like my previous cardiologists have done. And I still keep the blood thinners going until then. And he said, let's keep it up until the visit and then reevaluate at the visit in terms of, continuing to take them. Obviously, I'll be on aspirin and Lipitor for the rest of my life, but the Eliquis is up for debate, so hopefully it'll be done by then. Anyway, so we'll get to the pain management doctor today, and I was telling him about, my legs and the burning and my foot, which is, I think of that Bruce Springsteen song, I'm on fire, and it's like, that's my foot. That's literally my foot singing constantly. I'm on fire because stupid bones. I don't even think if they did any kind of repair on it that it would undo the damage that's done to the nerves down there. Once your nervous system is all screwed up, it's not a good idea to inflict more trauma on that area, because then it's just going to get worse. So I think that ship has sailed. But I don't know. I have to ask him. And so I saw my pain management doctor, as I have said 82 times already in this video, but I told him about the nerves at the top of my leg, and he said it is not uncommon when people have that kind of a procedure where the blood vessels, it's all a very small space, the blood vessels are close to the nerves, and inadvertently sometimes things get moved, poked, touched, cut, whatever, and it causes problems. And so he wants me to use the ketamine lidocaine cream on that area, and just at the top of my thigh, and to keep him posted on how that's going. And so far that's not all the time, but it's a lot of the time right now. So let's hope it stops, because it's annoying. But my lower legs and my foot. That's like, it's making it hard to walk properly. The pain and stepping and I have the pad. I bought these little, they look like little donuts, that I place over that part of my foot, and I tape it and everything, and it keeps my shoes from hitting the bone every time I'm walking with shoes on. But the pain is on the bottom of my foot now, and on the top of my foot, and at the tip of my toes, and it's just like, son of a gun. So yeah, so that's fun. So he said to keep him posted on that, and I'm using ketamine and lidocaine like it's my full-time job, covering my foot with that cream. But that's all we can do at this point. And so I have to see my podiatrist, who I have not seen in a very long time, and it just felt like back burner stuff after the stroke. And my urologist, because I have to follow up with her for a bunch of things that are happening. And like I think I'd mentioned a while back, they didn't know if the CRPS is in my bladder or in the muscles and organs around my bladder. And so lots of fun. This is just so much great thing. Oh my God, I can't talk. So many great things come with having all these things. It's like, yes, yay. But anyway, so he was happy with overall how I looked and everything, and he was like, all right, just keep me posted, and I'm going to see him again next month as per usual, but just to, check in with the leg. Oh, but the other thing was we're doing an injection on my back because the sacroiliac joint is being a jerk again, and my back is locking. It's locked right now. Yes. And that's spreading out a little bit. So when that locks or pinches, it just radiates. And so it's just like, yay, let's all be a jerk. So then my whole lower back gets involved. And so that's been a problem. And the more I walk badly, the more, did that even make sense, that sentence? The more I am altering the way I'm walking, it's affecting my whole leg, which is affecting my hip, which is affecting my back. And so this is like, I've got to deal with this stuff. And my knees and everything. I've got to deal with these things now that my brain and heart are somewhat under control. At least my heart is. And then tomorrow I'm seeing the stroke specialist, who I have to tell about a few things. The tracking is tricky. Lights are better, depending on where I am and what light I'm talking about. Patterns are a little bit better. But the tracking, if I'm like in a moving car, I can't look out the side windows. The front I can deal with for the most part, but side, like the speeding cityscape or whatever, can't do it. I cannot look because it literally feels like my brain is saying stop. There's like pressure when I look by my eyes and my head hurts. But last week when my nerves were so like, I felt dizzy and sort of disconnected from like the tracking. That's really hard to explain. But it didn't feel right, and I just had to get out and walk a little bit, and but even like when we're in the park, if I'm looking across the field and like looking at that expanse of green, like one color, or flowers, one color, that's a lot. If I'm in a store and there's like a lot of one thing, like I talked about the hair products in my blog a few like months ago, it all looked like the same box, and that was too much. Or bottles of shampoo or whatever. If I'm looking at a lot of something, the patterns, for some reason, it makes my head hurt. So I have to tell him about that. That's fun. But yeah, I have to stay on the blood thinners for 3 months. I'm seeing my cardiologist. What is wrong with me? I think I'm tired. Again at the end of the summer, early fall, and we'll reevaluate the blood thinners then. He said he didn't want me to plan a date to stop it at this point, just to keep it going, and then we'll look at it when we look at it. But yeah, so he was really happy, and that made us happy because it was just great. Last thing, and then I'm gonna wind this Weirds mobile down for the day, is yesterday I brought thank you cards for the surgeon, for his staff, and then for the pre-op recovery group who had taken care of me, because when I've had surgeries in the past, and many they were, that did not even make sense. And there were many. Oh my gosh. My brain is like, flip things around. Don't make sense tonight. There were many. I was never in the same space pre-operatively and post-operatively. It was a different team, and we knew who they were because we'd been there so many times. So they knew me, they welcomed me, they were super great, super nice. But then I was with a whole different crowd of people after the procedure was over. also a great group of people who we got to know over time. For my heart, I was in with the same staff. They saw me in the morning, and then they were taking care of me in the afternoon, which was really nice because, it was just nice to see the same people. And even though I was out of it, I recognized them, and they were, welcome back and everything, and really good. So I brought these cards. And so when I went, I had given them to the surgeon and his office staff, but then I said, and I wanted to drop this off in the pre-op area if I could with the staff. So I went to there. I figured out where I was going. Mount Sinai is a little bit of a maze, but I got where I was supposed to be. And when I went in there, I said to the people at the desk, I was like, I was just wondering if I could leave this card for the staff in pre-op, post-op. And they said, oh, you can bring it back. So I was like, wait, what? And so I didn't think that was allowed, and it just felt weird to me. But they told me where to go, and so I went through the doors of, you're not allowed through here. And when I got there, the unit clerk was there from the day I had my surgery, and which was nice. She was so nice. And she said, oh, can I help you? So I explained, who I was. I'd been there 3 weeks ago. I had my surgery. And I said, I just wanted to drop off a card for you guys because everybody was so great. And she just sort of stood there like, wow. And I was like, this is so awkward. And she looked over at the people sitting at the desk, and I did too. And I'm standing there like, oh, well, I guess I'll go. And she said, thank you. So I was like, no, thank you guys. You were amazing. But then she just was holding the card, and I thought, I wish there had been a gift inside. It was just a thank you note. But I was like, I felt bad. But I realized something. When you have surgery, you pass through these areas relatively quickly. It's not like when you're admitted on a floor and you see, like, I worked evenings when I was working in the hospital, and so I would see the same people for as long as they were in the hospital. I had those people from start to finish. And they would see me from, 3 to 11 every night. And, it was just, we got to, chat, whatever, and then they would be discharged. In this case, you see people for a blink. They check you in, they get you ready for the OR, and then you're gone, and then you come back and you're out of it. And so I don't think that they get to be properly thanked and acknowledged for how hard they work. And when they're really good, I'm not saying like everybody deserves a big dramatic thank you, even though they do. But when they've done a good job, people deserve to be thanked. And I was thinking of my sister and my cousin who are active hospital RNs working on the front line, and how hard their jobs are. And, being a staff nurse somewhere, or an ancillary staff, nurse tech, surgical tech, you're on your feet all day, you're running around, there's a lot of spinning plates, and it's a big responsibility. And when you're doing your job very well and with kindness and compassion, which was the thing that I couldn't get over, like, I could hear how overworked they were and possibly understaffed, and they didn't know who was coming in. But every time they popped into the room, they did it with a smile, and they were so friendly and kind and just compassionate all the way around. And that takes skill to look like everything's great, and it's not an easy gig to have. And when people are doing it well, it's good to be thanked and appreciated. And so that when people do things wrong, I am very quick to correct them and let them know that. But when we do things right, or when people do things right, medical staff, doctors, surgical people, the nurses, let them know that they've done something right. Because I don't know, especially in that situation, in an OR situation where you're just breezing through and you don't see those people ever again, unless you have surgery again, and then it's a crapshoot. Who do you get? You're passing through. Say thank you, because these are hard jobs, and it's hard. And so I could hear that, and I was just thinking about my sister and my colleagues and my cousin and the people that I was in nursing school with, and it's a hard gig to have, and they do a lot of hours, and there's no appreciation from possibly the institution they work for, or little thank you. And this was Nursing Appreciation Week, International Nurses Week, and so it was nice to be able to say thank you to them, because they're an extraordinary group of people in the cardiac cath lab at Mount Sinai, and I cannot say that enough. They're amazing. And the surgeon and the whole team, everybody, from the security guard that met us at the door and wished us good luck, to Stan, who wheeled me downstairs and got me in a good spot so my husband could help me out easier. Start to finish. What an experience. And I've had many procedures and met many, many, many medical professionals and so-called professionals. So just say thank you if you can. It matters. And judging by the look on their faces, that it's an impossible situation and it doesn't happen. And I thought of it because I was thinking of my sister and my cousin. And if I had been in that situation, that it would have been nice to hear you did a good job for me and thank you. And so that's where I was. And it's like, plus I'm also riding high on they saved my life. So, you know, like thank you cards aren't enough, but that's what I've got working with me. So working for, I don't know where my head is. My words are not connecting properly. So I'm just going to stop because this is going on too long anyway. And now you're really hearing how my brain is all like skedaddling and it's all falling out of my mouth. So yay, words. But anyway, this is what's happened thus far. This is where we are. I hope wherever you are that you have a low pain, no pain, low aggravation, no aggravation kind of a day, kind of a week, and kind of a weekend. That is what we hope for. That is what we deserve, and that is what I wish for each one of you. I hope you're doing okay. If this is a bad week, I hope it gets better. I just hope a lot of good. And for all the nurses and doctors and medical people who are doing it right every day, thank you, thank you, thank you. I don't know that you hear it enough, but from my family to all of you, you are the heroes. So thank you. Have a good night. I will see you tomorrow via the blog, next week for another video. Bye. Be well.